Hello there. Welcome back to Hormones Simplified. So today's topic is about what constitutes modern hormone replacement therapy. I'm not going to differentiate between menopause for women after 50 and premature menopause, although there are significant differences in the risk profiles for these two groups of women. But we're going to talk about what hormones are present in modern form of hormone replacement therapy. So, hormone replacement therapy aims to replace three key hormones: one, estrogen, two, progesterone, and three, testosterone. I'll repeat: estrogen, progesterone, and testosterone. Why I say it's modern hormone replacement therapy? That's because HRT has been around for decades, and the various hormones that have been used in HRT have undergone a lot of transformation over the years. So let's look at each hormone one by one. What does the hormone do, and what sort of preparation is available that can be made best use of? So let's start with estrogen. Estrogen is the key female hormone. This is the hormone which is principally the most important bit of HRT. It is the lack of estrogen that gives rise to menopausal symptoms primarily. And so giving estrogen is the key. Estrogen is usually is available or is synthesized in three forms. It's called estradiol, estrone, and estriol. The key part of hormone replacement therapy in modern HRT is estradiol, the technical name being 17-beta estradiol. It's a form of estrogen which is often described as natural estrogen, and that's the same, almost like for like, as would be produced by the ovaries. Estrogen is key because it suppresses menopausal symptoms, including hot flushes, night sweats, sleep difficulties, changes in mood, vaginal dryness, lack of sexual desire, joint and body aches, dry skin, dry eyes, and any other symptoms because of lack of estrogen. It is also the key hormone which maintains bone health. It helps bone making cells and it prevents loss of bone, and therefore it maintains bone health and prevents osteoporosis or brittle bones. Estrogen is also important for heart. As you will know, women always have a lower incidence of heart disease than men, and that's because estrogen is the hormone that actually keeps the blood vessels of the body very supple. It keeps the arteries very supple. It reduces the bad cholesterol and it improves the good cholesterol. It therefore basically helps the heart pump blood better. So estrogen is key for heart health, and longer the woman is on estrogen, it will automatically give some indirect benefit for heart health. Then let's look at estrogen in terms of brain activity. There are some studies now which do suggest that if estrogen is given early during the stage of perimenopause, around 45-50 years of age, it may help preserve cognitive activity and delay the onset or prevent the onset of Alzheimer's dementia. Now, this is not conclusive. Studies are still going on. There have been contradictory studies when progesterone was combined with estrogen as part of HRT. But in general, most of the evidence does point to the fact that estrogen given early does preserve brain function and help cognition. That's all the good things about estrogen in terms of the suppression of symptoms and the health benefits for the bones, for the heart, for the brain. But what can be the downsides? I'm going to make a separate video on side effects and the risks of HRT. But just a quick word on what estrogen can do in the short term. The common side effects of estrogen include nausea, headaches, breast tenderness, feeling bloated, and sometimes estrogen can also give rise to headaches by itself, which are migraine-like headaches, which are not the usual headaches. Now, estrogen and headaches have a complex relationship. The lack of estrogen itself can trigger headaches, but excess of estrogen can also bring in headaches. So we are going to discuss estrogen, hormone replacement, and headaches as a separate video. But these are the common side effects or common problems which are associated with use of estrogen. The long-term risks, such as the blood clotting, the risks of cancer, what are they and how much they are, all those I will cover in a separate video. The second hormone is progesterone. Progesterone is a hormone that's mostly linked to fertility. It's normally produced in the female body after ovulation, after release of egg, in preparation for the pregnancy every month. Progesterone has few actions where it suppresses few of the menopausal symptoms, such as it does suppress some hot flashes, does actually help with sleep. So there are few effects progesterone has in terms of suppressing menopausal symptoms. But this hormone is really part of HRT to protect the womb lining. Progesterone is not required as part of HRT if the woman does not have a womb. This may be because of hysterectomy, operation for fibroids, surgery for endometriosis, or any other ovarian cyst or tumors, or tumors of the womb or cervix. So if the womb doesn't exist, you don't have to have progesterone. But progesterone is given for all women who have a womb in place, and that's because it protects the lining of the womb. If the woman has estrogen alone, then there's a risk that the estrogen may thicken the lining of the womb and make it unhealthy, which in long term can be a risk for cancer. By giving progesterone, you try to minimize or eliminate that risk. So progesterone as part of HRT is really mainly for protecting the womb. Progesterone is a hormone that has side effects such as headache, bloating, PMS-like side effect, mood changes, etc. And it's best to keep the level of progesterone in HRT as low or as minimal as possible because it has a very tiny role. But it's important that it's enough to protect the lining of the womb. We'll talk more about progesterone in another video. Finally, let's look at the testosterone. Now, women make a lot of testosterone. It's often thought testosterone is a male hormone. That's actually not true. Females make a lot of testosterone. And it's very important for sexual function, for libido, for energy, for bone mass and muscle strength. So testosterone is very important because ovary produces a lot of testosterone, and during perimenopause or menopause, testosterone levels do drop eventually. So testosterone has an important role in terms of bone mass, muscle mass, libido, energy. And again, we will be talking more about what testosterone can do and how is it used in another video. Final word, you have estrogen, progesterone, testosterone available as natural body identical hormones now. These hormones have very good safety profile, very low long-term risk. And so modern HRT tries to use all these three natural hormones, usually as patches, gels, combinations with tablets, in the safest possible way so that most healthy women will have very little risk or no risk from use of HRT, but a lot to gain. More details about this in another video. Until then, take care. Bye.